Thanks so much, Anna. Appreciate it. Um, Welcome. Thank you all for joining us today. My name is Valerie Smith. I'm going to tell you a little bit more about myself in a moment, but today we're going to be talking about ways that you can use data to focus efforts and maximize impact if you are involved in a anti-hunger organization or specifically in a community coalition that's working on anti-hunger issues. I am going to ask some questions for you guys to answer as well in the chat box, just so that we can hopefully make this as interactive as possible. So I appreciate it if you will share information as we go. Here we go. Sorry. So I just wanted to start out by telling you all a little bit about me and how I came to this work, because it is kind of unusual in my experience with people who are working in food security coalitions or anti-hunger groups. So I actually am a pediatrician by training, and that's my day job. I work at this wonderful organization here in Tyler, Texas. So Tyler is halfway between Dallas and the Louisiana border in kind of deep East Texas, called St. Paul Children's Services. And our organization was actually founded 30 years ago. We had great intentions of having a really wonderful 30th anniversary celebration that COVID has postponed, but I'll just figure out a way to celebrate 31 or 32, hopefully. But our organization actually didn't start as a clinic. It was started by the Methodist churches in our community about 30 years ago, when they recognized that there was a neighborhood in Tyler that had had a really significant decline, kind of socioeconomic status-wise, and a really significant demographic shift. It had gone from a predominantly white neighborhood to a neighborhood that included a large number of recent immigrants, mostly from Central and South America. And so that church wanted to do some outreach. So they actually started an after-school program. And I think what happens many times for those of us who are involved in social services work is that when you start to have relationships with people, when you develop relationships, you start to understand their needs and their world much better. And so subsequently, after the after school program was started, a food pantry was added and a clothes closet. And then following that, pediatric medical and dental clinics. We also have a host of other services now that we provide, including English as second language classes, exercise classes, financial literacy, in addition to a host of other community outreach pieces. But we had been doing the work of feeding people, right, as long with healthcare, long before I even came to the organization. I've been there for 15 years. But several years ago, we had the opportunity to receive some funding from the Episcopal Health Foundation, which is a funding organization in East Texas that really was designed to give us flexibility to look at our community and see what community conditions were driving poor health outcomes for the patients that we serve, but also the greater community, and then to work on community-based solutions for those. And so given our history and given the rising rates of childhood obesity and high blood pressure and diabetes that we were seeing in our pediatric clinic, we made the choice to focus on food, and at that time founded the Smith County Food Security Council, which I chair now, and we'll talk about that more as the day goes on. Just a few other things to know about me. I am a health policy nerd. I just finished my master's in public health at the UT Health Science Center here in Tyler, and I'm currently the American Academy of Pediatrics Child Welfare and Health Policy Fellow. So I like to talk about direct services, but I really like to talk about and think about how things can be impacted at local, state, and federal policy levels. I've spent a lot of time advocating for children's health, both through the Texas Pediatric Society and the Texas Medical Association. And I serve on a lot of different organizations within our community, including on the board of our the East Texas Food Bank and the Northeast Texas Public Health District. I also am a mom of 3 fabulous kids, so I juggle all of those things. I am not a person who would do well going to work and doing the same thing every day, but really enjoy getting to weave all of those parts of my life together. So just to give a little bit of background about the Smith County Food Security Council, because most of our discussion today is going to be along the lines of how our Food Security Council has utilized data, and then how that maybe could be applied to organizations that you all are working with. We were founded in 2018, again, as part of that work from the Episcopal Health Foundation. Our mission is uniting our community to reduce hunger and improve health in Smith County. And our vision is that everyone in Smith County will be hunger-free and well-nourished. To give you just a brief idea of the overview, these are the organizations that are represented on the leadership team of our Food Security Council. So our public health district, our food bank, our largest local school district, my organization, St. Paul Children's Foundation, as well as our local federally qualified healthcare center, which is the Tyler Family Circle of Care, our local university health science center, Christus, which is our largest healthcare organization in our community, and then Better Living for Texans is actually the agricultural extension of the Texas A&M, and so provides support both for farmers and for community members in order to help Texas agriculture thrive. And then finally, the Children's Defense Fund, which many of you may be familiar with, which in our area is focused on really increasing access to healthcare and quality education for children. And then the East Texas Human Needs Network, which is a collective impact anti-poverty group in our community. We have a lot of other members of our coalition, but those are kind of the people driving the bus or at the table as we make leadership decisions. And then just to give you a little bit of brief structure, so that leadership team kind of oversees 5 work groups that each have specific strategies and goals that they work on. We'll talk about a few of those as we go on today. So we have a group that's working in urban agriculture, a group that's focused on children in schools, one that's focused on healthcare, one that's focused on community awareness and advocacy, and then one that's focused on faith-based and nonprofit organizations. You might notice that a lot of these are common areas of focus for anti-hunger coalitions and food security councils across the country, if your community is fortunate enough to have one already. We do, as you might have noticed in both our mission and here, we do have a really significant presence of healthcare organizations and a real focus on quality or access to quality nutrients, partly because that's where my organization sits, but also because part of the goal here really is to help reduce food insecurity, but also to improve health outcomes. So just to kind of talk through what to expect today and where we'll be heading here. First, we're going to take a look at some existing publicly available data sets that you can use that may be helpful for you to with programming decisions or focus decisions of a food security organization or council. And then we're going to talk about data that you could actually collect or create yourself and some tools to do that. And then I want to conclude just by talking a little bit about coalition evaluation and improvement plans and how we can, some data options for collecting those pieces as well. I will say I have always said that I am a community pediatrician and I'm not a researcher and I'm not a data person. And when I actually first gave this talk or a version of it, Katie Nye at the Texas Hunger Institute initiative, which is now the Baylor Collaboration on Hunger and Poverty, but asked me to talk about data last year at their summit. And I was like, I don't really do data. And she was like, yes, you absolutely do data. You just don't call it that. She was like, you are absolutely using and collecting information to inform your decisions and to better your community. And that's what I want to hear people talk about. So hopefully this will feel accessible, because I am not a data nerd by any means, and have come to this somewhat reluctantly myself. But let's start with what data is kind of out there that's already available. I am sure that you all are aware of data sources from Feeding America and Tract, for example, the Food Research Action Center. So I really wanted to talk about some other data options today, or things that are available. And the first thing that I just wanted to mention, because this really was part of the impetus for the for the formation of our community is that there often, you may have local health disparities data that you don't even know is there in your community. So this is a report that came out in 2016 from our local University Health Science Center. So if you have an academic medical institution or teaching hospital in your community, there's a very good chance that they have done a similar report, really looking at disparities within our community. So what this report did is looked at our East Texas region versus Texas as a whole versus the United States, and then broke down a whole host of different types of health outcomes. I just screenshotted a couple of them to give you ideas of what were there, but it helped us look at heart disease, which we know is intimately related to diet and food access, right? And seeing those disparities both in that our community overall had significantly higher rates than the state and national averages, and then also that we specifically had some disparity there among our Black population. And then looking at other things such as access to exercise and consistent healthy diet, all of those types of information were found in this report. So this one doesn't have a link to it because this is particular to my corner of the woods, but it is a place that a place to look for your kind of generally if your community has this resource. I'm actually going to ask you guys now, as we start to head into some other resources, if you don't mind sharing with me in the chat box where you're from, because we're going to hopefully, if technology is my friend and does everything I need it to, we're going to link to some external sites. And rather than just look up where I live, which I've obviously already done, I'd love for us to be able to use as an example some of the places where you all are from. So if you don't mind adding some of those in the chat box now as we move along. The next kind of data source that I wanted to mention is the county health rankings. And I'm not sure how many of you all are familiar with those. And I do think this is a project that was actually originally initiated in the University of Wisconsin, but is really helpful and does have a lot of health data, but it has a lot of other data. So sometimes having the name health on it isn't particularly specific. So the county health data rankings, the ones on the right side are some of the things that pop up for my particular county, right? Gives us food insecurity rates, also gives us a food access measure, as well as a whole host of other things. So I'm actually going to click on it and looks like, okay, so I'm going to take Albuquerque, New Mexico, which is, oh, I know Patty. Hi, Patty. Patty actually came to Tyler and helped us with one of our very first events for our Smith County Food Security Council and how we were educating our healthcare providers in our area around food insecurity. But so this is the landing page for the county health rankings, and then you can go to your state reports. Hold on. I do have a couple of windows. So let's take New Mexico. Sorry. It's always fun kind of when you do these things in live time, right? So you can download the full report in a PDF form for New Mexico. It also lets you look at different, so these are kind of just the general outline of the health outcomes. So here's New Mexico, and it has this lovely interactive map. So someone's gonna have to help me know where Albuquerque is. Patty, what county is Albuquerque in?
Can you hear me?
Yes.
It's Bernalillo. So it's kind of centrally located actually, and it's white on this map.
Ah, right there. Okay.
Yeah.
So what that tells us, just looking generally, is that that's one of the healthiest counties in the state. So the county health rankings rank your counties within your state from 1 to whatever, right? So we got 258 counties in Texas, I believe, but you guys don't have quite so many in New Mexico. So it's actually one of the healthiest, which probably doesn't surprise me in that there's probably a really good economic base there. But then you can start to click and go into different health behaviors, right? Also access to quality care. And then here's where a lot of food insecurity information can be found sometimes, is in the social and economic factors as well, that give you education, employment, family social support, community safety. And then there's also the physical environment. We'll have some food pieces as well, including that, like that food access number that I mentioned. You can go by county. So if you want to get as specific as the county you live in, as opposed to the state, depending on what kind of agency you're working with, then you can kind of drill down as specifically as you want to. And then you will get tabs that look, let's see, like, sorry, sometimes it's slow. Oh, I can't spell Albuquerque. Okay, Patty, I've lost my mind. Y'all, spelling is not my thing.
It's a U, so it's ALBU.
Alba.
Q UER QUE. Oh, but that's for the city. So maybe you need to say Bernalillo because that's the county.
Okay, or even a zip code in there is fine.
You can do 87108.
Okay, there you go. So here we go. So there's your county, and then this gives you all of this quality life, just basic county information, like information. And then here's those health behaviors. Here's where you find those socioeconomic. So this gives me graduation rates. It gives me percentage of children growing up in poverty, as well as income inequality, all those sorts of things. In addition, when it gives you these things, it gives you a percentage, but it also tells you kind of where you fall along the top United States performers, and then where you are statewide. For each of the larger categories, this is where you rank. So there's 32 counties in New Mexico, so that's where Bernalillo County would fall. There's information about physical, like, do we have access to clean drinking water, or is that an issue in the area? Transportation, which is often a huge issue as people are playing around with or thinking about food access, right? And then during each of those, it'll have those few kind of listed up at the top, but then you can go to a whole nother set of even more detailed exposures there, and things that tell you median household income, educational outcomes. There's a lot of injury prevention pieces. Here's where we find some of the other pieces about housing ownership and traffic volume, things like that, that really can play a role in food access. So that's the county health rankings. Let me go back here to my slides so we can go from there. So the US Census has a tremendous amount of data. I'll go back and add that county health rankings piece. I had meant to stick the links in the chat just to help you guys out as we are moving forward. US Census is easy because it's uscensus.gov, right? And actually, to get to the tables and stuff, you can do data.census.gov, and it will get you there a little bit faster. So the census data is really robust, which is really helpful. It also means it sometimes shows up in these not super helpful tables, or kind of more challenging to use. So I screenshotted and copied this one just to give you an idea. What I had to do in order to kind of make sense of this is the census tract map and that's easily available on the Census Bureau website. So for my area, and then what we were wanting to look at is where we had areas that would likely have high rates of food insecurity within those smaller. So the county health rankings are great because they give us a picture of the county, but we wanted to drill down even further and look at specific neighborhoods, right? So the census tract data is really helpful for doing that. And this is just the poverty census tract data that I pulled up for our area. And what I'll highlight here is that we were we were looking at percentage of families who were below the poverty line. And as you kind of scroll down here, you see, okay, so this first one's relatively high, and that's census tract 1. And then you keep going, and we had an outlier here, right? This 2.01 was really high. And then the next one below it, that 2.02, were really high. So as we were thinking about what we wanted to do as a coalition, this really helped us target in on an area, in addition, just on this one screenshot, to poverty and people who are living at poverty. It also gave us information about employment. It gave us information about people who didn't have any health insurance, which often correlates with food insecurity as well, right? And as well as the number of people who were having to commute to work, which is relatively low for our population because of the type of community I live, but in other, for those of you all who are in larger metropolitan areas, maybe of real importance, again, thinking about those transportation pieces. There is a whole set, you can see here, there are tabs that allow you to choose, occupational breakdown of people within different communities, different health rankings, assorted other pieces. You can look at specifically at median income, home ownership, all of those things, looking at these smaller areas within a community. The next one I wanted to talk about is the Social Vulnerability Index. So it is developed by the CDC, and what it does is it puts together 15 factors from the census that helps us look at local officials and communities kind of identify where they may be at risk. It was actually designed as a disaster preparedness tool to help communities plan for where there might be transportation gaps if they had to evacuate, or where there would be higher risks of needs or health complications if there was a tornado or a hurricane, for example, or an earthquake. But really, I think this tool is very helpful to get a kind of a broad overall picture, again, of smaller chunks of kind of areas of communities, to look at geographically if you want to focus programming or you're trying to focus an intervention. And I will go to the next one. So this is my little neck of the woods, right? So these are broken down even smaller than those census tracts for us. And so this is our county, and it scores things from from 0 to 1. So a 1 is kind of the most vulnerable, and they use 4 basic categories of classifications: socioeconomic status, household composition, race, ethnicity, and language, and then housing and transportation. So if you look at my county, Smith County overall, it scores kind of in that moderate range, right? So it's 0.7249. But remember that census tract that I mentioned earlier that we were just looking at that data from? When you look there, that vulnerability index is 0.9737, which tells us that it's a very vulnerable population, which means they have very little internal resources to be able to respond to times of increased need. So this was thought of as a lot of disaster preparedness. What I'm finding is that this is a particularly helpful tool right now during COVID to assess which communities are going to have greater need in the realm of food access, as well as other social supports. And again, let me open the chat box real quick, find another place. Oh, okay, and Marina wins the prize for the day for putting all of the links in my chat box. Thank you so much. I don't have a parting gift, but so let's take a look at, I don't know where Fort Pierce, Florida is, but let's see. So you can do this one of 2 ways. You can either put your address in, or you can actually zoom your map in where you want it to go, right? But so let's do. There we go, Fort Pierce, Florida. Okay, so here's Fort Pierce, Florida. Let's should open. There we go. So if you want to look there at the county, that gives you that overall vulnerability index for the county. And then if there's more than one census tract, it will let us. Yes, so it'll let you pull, and I don't know that county, so I don't know which different census tracts, but see how it's letting me, it'll let me pull different census tracts. You can also look here at this next neighboring census tract and see, again, very vulnerable area. Interestingly, kind of this lock. Let's see if we can zoom out. So a very vulnerable area surrounded by kind of a large moderate zone. Kind of interesting there. And then I wanted to take a little bit of time to talk about other things that are going to provide you with even more information about your local community. And that is, so when we started our coalition, everybody was like, you need to do a needs assessment. And I'll be honest, we were a small group. We had very limited staffing. And I just was like, this feels overwhelming to do a whole needs assessment. It's again part of that when I told Katie this was not my thing. But what we came to discover and really think about is that there actually are needs assessments that are happening all over our communities all the time. And there are opportunities to use that information, and then also opportunities to really to maybe work with those organizations that are already doing those to expand the information around food and food insecurity that we're getting. So who does community needs assessments? So any hospital or healthcare system who participates in Medicare or Medicaid has to do a community needs assessment on a regular basis. Many nonprofit organizations do them as well. And then many government entities or grantees of government entities are required to do community needs assessments as part of their training or as part of their grant fulfillment. This link here is, and we'll see about sharing slides, but is just kind of the framework that the CDC recommends and guidelines and principles around doing a community needs assessment. So we had an organization in Tyler in Smith County that was already conducting needs assessments, and that was the East Texas Human Needs Network. Every 3 years, they did their first one in 2013. They're a relatively new organization, but on a 3-year cycle, conduct a comprehensive community needs assessment. And so as we were forming as a coalition in late 2017 and early 2018, we went through their community needs assessment that had a whole host of data. But one of the things we noticed is that there wasn't a lot of information about food or food insecurity there. And so these were the questions that were related to food that were on the community needs assessment at the time. They asked whether we chose, whether a community member who was responding to the survey had to choose between food and bills. And what you'll notice is that a whole lot of people said no, about more than half said no. But then 19% of our population said that they were having to choose between food and other bills, including healthcare bills, every month. And so that's a really significant portion of our population. And then they also asked about if you were hungry but you didn't eat, and the results are there. About a third of people responded that they were hungry and didn't have food or skipped meals. So that gave us some good information starting about kind of the scope of the problem and the trade-offs that people were making in our community as we were developing our Food Security Council. But what we were able to do, again, knowing that as a small new organization, conducting a whole community needs assessment might be outside of our bandwidth, or might be really the only thing we could accomplish in our first year of working together. We decided that we would actually kind of utilize the relationship with Ethan that we had developed and see if as they were developing their 2019 needs assessment, if we could incorporate more questions around food and food insecurity that would allow us to have information to move our coalition work forward. And so we were able to do that. So one of the things we did is we just integrated the Hunger Vital sign, which many of you all are familiar. It's the first 2 questions from the Census Core Food Security module, and has been validated as a reliable screen for food insecurity. So we had them add both of those questions in, and you see that for food insecurity purposes, a yes to either of the questions was considered positive. So we had 37% of families who reported being food insecure, and then we were able to ask people where they were getting their food. So the majority of people in our that were surveyed, 60%, grocery stores, but you see that almost 20% had utilized a food pantry at some point. And then we had a lot of people who were utilizing fast food, as well as a smaller percentage utilizing convenience stores and gas stations. And then we were able to ask people if they if they were going to buy just enough food for their family, for what their needs were, would they have to spend the same, more, or less? And 45% of people said that they actually needed to spend more money than what they currently were spending on food. And then we were able to ask the follow-up question of how much more. And there's a lot of variation here, but what we see is that $20 or less is going to get very few people over the hurdle, right? That really, if we're looking at advocating for example, policies around SNAP benefits or other federal nutrition program benefits, we really need to be advocating that households have a significant bump in those benefits to really help get them out of food insecurity over time. And then a couple of other questions we were able to ask. One was about how often. So that first question, the first question, or the previous question that asked about, did you get food from food pantries? So these were just the people who answered yes to that. And what this was really interesting to me, and I think holds true for what we know generally about food insecurity, and that is that there are a lot of people, if you add up those first two categories of just needing to go 1 or 2 to 4 times during the year, almost 40% roughly of our population just occasionally needed some help from a food pantry. But we had 35+% of the people who were utilizing food pantries who were utilizing them every 12 months. And this really sparked a conversation among our Food Security Council leadership about thinking about targeting interventions as we move forward towards those families that are having persistent long-term food insecurity and are needing support on a monthly basis. And then this was that repeat of that question about how often during the past month or during the past year families have had to make a choice between food and other bills. You'll note that for 2019, that number went down a little bit for our community, which is great and progress, that only 14% reported needing to make those choices every month, and that a little bit larger percentage of our population said they never had to. I unfortunately anticipate that if we were to repeat this question in 2020, those numbers would be really drastically different right now, given the state of the world and our economy. So those are some kind of big data sets that are available to anybody, for anybody to use, or that you could access or potentially collaborate with your community to help you better understand the community you're serving, and even potentially just determine locations or target populations for interventions. I then wanted to talk a little bit about data that you can use to collect to kind of develop or refine your programs a little bit further. So this is data that you would be doing, or someone within your organization or your coalition would be doing some legwork on. But it often doesn't take a lot of legwork or time to get some really useful information. So the first thing that we did as we were starting to develop a program so we use that census tract data to help develop or determine a location where we wanted to start providing produce drops in conjunction with our local food bank, who was able to help provide us the produce. And then what our goal was, and what we were able to do pre-COVID at least, was bring together community organizations that those that people in that community might need, things like Medicaid enrollment assistance and WIC and other social services organizations, employment organizations, and bring them together and have them there. Most of those organizations weren't located in that census tract, right? So people, if they wanted to access those services, typically needed to go to those organizations to access their services. And so we were trying to bring those services, at least on a regular basis, to the community that was kind of in highest need in our area. And so in order to kind of determine, okay, so now we know generally where we want to do this, or where we feel like there's the highest need, and looked at the kind of lack of resources in that area that were available within walking distance or on public transport. So then we started figuring out, okay, so then how do we decide exactly where within this community we're going to do this, and who we're going to build partnerships with. And I will say the picture on the top right is actually where we ended up. That it looks like a school because it is an old school, but it's actually a church now. It's New Days Community Church, which has been, up until COVID started, was the site of these events for us. And so what we did is we completed a neighborhood survey. So a neighborhood survey can be done by walking, or it can be done by driving through. Some some people call them a windshield survey. This is the template that we utilized. Was developed by the Episcopal Health Foundation, which is a grant funder for our organization. But it helps you kind of think about different parts of a community, and use just observation. And then if you are doing walking, you can also talk with people you run into, but about what kind of the resources are, and then what maybe the needs of the community are. So helps us look at different types of housing. The first thing is to define the community, right? The size of the space of the community, but then also to look at housing, open spaces, right? So especially if you're looking for we needed something with a large parking lot, to be able to bring the 18-wheelers in with the produce, those sorts of things. And then looking at what resources are there as far as like shopping. So what food sources are there already, schools and religious organizations that are there, what other health services may be there in addition, because those may all be really important potential partners. Also understanding what is there and what's not there is really important as we were deciding, what organizations we wanted to make sure we invited and included to come into the community for those events. And then transportation options, how walkable is it? And then looking at safety as well as just neighborhood life. Are people out walking around? Are there places that are safe for community gatherings? Different things like that. That really helped us to determine where the best location was for that event. And those events, so that EHF one unfortunately is not available online. I need to pester them about getting that one up. But there is the Community Toolbox guidance, which is actually out of the University of Kentucky, but has a ton of guidance for community coalitions, but specifically has some templates and guidance on windshield or walking surveys. And then the CDC also has some tips for data collection as well, you can find. And then we knew that we wanted to create a food bank healthcare partnership. We had some funding that we'd obtained, but we knew a lot about my clinic, right? But we didn't necessarily know a lot about all the other clinics. So one of the things that we did is just made outreach as we were forming our healthcare work group and ensuring that we had organizations from each of our healthcare entities in our community who were participating in that work group. And we just had them do a really simple survey. We wanted to know, were they already screening for food insecurity or not? If they were, which tool were they using? What EMR or electronic medical record they were using, because many of them have food insecurity screening embedded in it already, but providers don't always know that. We also wanted to know a little bit about the patient population they were serving. So whether they accepted Medicaid and whether they saw uninsured patients, and if so, how they did billing there, whether they provided a sliding scale or other things like that, to give us a picture of that. That was really helpful information, because as we formed our healthcare food bank partnership, it gave us a really clear sense of direction as far as which clinics we needed to work with and outreach first, which clinics were kind of low-hanging fruit because they were already screening, and so they were kind of easy to bring on board for a healthcare food bank partnership, and then which organizations, because of their patient population, would be really important participants and partners, but also might need some additional technical assistance and training as far as beginning screening and integrating it into their electronic medical record. This was, we did this on paper. You certainly could use a Google form or a Google Doc. Took the people who filled it out less than 5 minutes to fill out, but really helped us focus where we were going intervention-wise. And then once we started that intervention, it's called Partners in Health. Just to give you a brief overview, it's so once families screen positive for food insecurity, the East Texas Food Bank is able to provide them 12 weeks worth of shelf-stable and fresh produce, healthy foods, as well as nutrition education. And then what we knew is that because we were working in the healthcare sector, and because we know that data talks with healthcare organizations and potential funders for programs like this, we knew we wanted to collect some data. So we collected biometric data, just weights, heights, blood pressures. For our adult diabetic population, also hemoglobin A1Cs, which is a measure of blood sugar. But also we had families fill out program evaluations and then a pre-test and a post-test that just looks at knowledge, behavior, and self-efficacy. And so that way we could start to get a picture of the kind of impact we were having on families. And then we used one more piece of data as we were moving along to help kind of refine those programs as well. So that roadshow that I mentioned before, once we started doing them regularly, we started asking participants to fill out a survey. And we certainly didn't survey everyone who came to every roadshow, but this did give us at least a picture of what was happening. And because we wanted to know if what we were doing was helpful, what would be more helpful, and if we needed to consider targeting other areas. And so we just asked people how they found out about us, because we wanted to know if our outreach efforts were being useful, how we might tailor those outreach efforts for the future. We printed up a bunch of flyers, for example, and you notice like nobody said that they got a flyer. So maybe we don't spend money on flyers next time, but man, the banners that we put at a couple of really key intersections in our community were really helpful to people. And then really just looking at that piece of social networking, that really finding out from friends and families was helpful. Then we asked people what they wanted to see next time, right? Do they need more medical services? Do they housing, dental, legal services? And you can see there's actually a kind of a really broad range, employment services as well, that our community is saying that they need in that area, but made sure that to help us then strategically identify partners for future roadshows who could help assist with some of those programs. We also asked people what was most helpful for them, because maybe we've got things coming or people who are there who we don't necessarily need to keep going with, right? And to keep pursuing. And so you see that the actual food was the most kind of helpful for people, which makes sense. That's really what drove most people to participate or to come. But that Center for Healthy Living is a place that's actually founded by or sponsored by our local health district, that provides health education and health screenings. And so they were on site providing blood pressure screenings, as well as cholesterol and blood sugar screenings. And so those, I think, were we also heard were very helpful. And not only were they able to screen, but because they provide that education, they're able to enroll people who are there in ongoing either education or healthcare supervision for those medical problems if they identified any of them. And then just looking at location, because what this helped us know is that most of the people were in that 75702 zip code, which is where we were located, but also 75701, which was adjacent to it. But then this kind of third one that was over here, this 5%, which 75757 was actually several zip codes away. And so one of the things that we're thinking about as we are looking to expand and do these programs more often is being able to provide, to do them in different locations and not just in that one simple central location. And then I'm just going to conclude by talking about our data that we've used to assess our coalition impact. And it's just a tool that I wanted to make sure everyone was aware of. So the CDC developed a coalition effectiveness inventory back in 2008. It asks a bunch of questions, like 74. So it does take a hot minute to fill out, right? But that asks people who are participating in the coalition to say whether these elements are present but limited, or absent. And so we sent this out not to everyone on our coalition list, but to the 104 people that we have who are active participants in at least one of our work groups. We got 21 surveys back, which in the scheme of surveying is pretty good, a 20% completion rate, although I would have loved, obviously to have higher numbers. But just to give you an idea of what it does, it breaks down into different categories. So there's like coalition operations and processes. What I did is then go through and highlighted things that we were relatively doing well, some areas that might be places for growth. So I'll point those out just as we move forward so that you can see kind of what we did with that. So orientation, new member orientation and member training was an area that kind of was a relative weakness. Leadership, there are some things that I was really, really proud of and happy to see here. all of the respondents saying that they felt like our coalition was promoting equity and collaboration was excellent. The issue of the challenge with leadership having appropriate time to develop, and then meeting management were two that we definitely took note of as we were collecting this data. Staffing, again, looking at that training, was very happy to see that the staffing piece had, strong knowledge and communication aspects, but looking at how to train members a little bit better. And then kind of the structures of our coalition. So we did not at the time, actually, we still don't, true confession, have formal bylaws. We do have some policies and procedures in place now that are a little bit more specific. And then those clarifications of job descriptions and organizational charts were some other areas kind of for growth from us. So it's great to survey people, but really what you need to do, to me, data is only helpful if you take action on it, right? One way or another. And so this is what our improvement plan based on those evaluation results included. We spent some time realigning the staff roles, and we actually hired a new coalition coordinator who's a part-time person who does a lot of the administrative pieces for us. We had a lot of our leadership who were also in leadership of their own organizations who just didn't have, like, the administrative pieces would get bogged down, and so that would prevent some of our forward movement. And so having a coalition coordinator, I don't know if Sabrina is on this talk or not. I know she's joining the conference, but having a coalition coordinator who's able to facilitate those administrative duties and make sure emails get sent out on time and calendar reminders and coordinating communication has been really helpful. She also has helped us develop a new member orientation that we had intended when we first kind of envisioned it to do in person, but we actually now it's on YouTube, right, as a kind of recorded PowerPoint presentation, so that as new people come into our coalition, we can provide them with a good broad-based overview and how they can become connected and active. And then we also, that Episcopal Health Foundation that I mentioned earlier that had provided us some funding, we went back and developed a collaborative agreement with them to provide us with some coalition development support and technical assistance. So for example, next month, they'll be doing virtual meeting training for the leaders of each of our work groups, to help them learn better how to facilitate meetings online, because as we are all realizing, this is going to be the way we do things for a while, and we want to still keep members engaged as we're moving forward. So I'm going to end and we'll have some time for questions. Just wanted to give you guys my contact information. So this is the landing page for our Food Security Council's website, but it's there, smithcountyyfoodsecurity.org. That's my email address at work. And then you can follow me on Twitter mostly if you want to hear about medical policy, but also a lot of food insecurity stuff too, and occasionally my kids. Hopefully this has given you all who are working either with coalitions or with food insecurity or anti-hunger organizations, some ideas of some ways that you can collect or utilize data that you might either have already been and didn't realize that what you really were doing was data work, or what you might, some ideas for places you might find information in the future or be able to use it. I will say those large data sets from national standpoints can be really, really helpful for grant writing if you are looking for data to support the need in your community. I'm going to open the chat box. I don't know if Anna, do you want to?
Yeah, I see one question here from Ben that asks if the participants could get a copy of the survey form you were referencing.
So I can get a copy of the survey form to you, Anna. Is there a way for that to be?
Yeah,
shared?
we can share that. Is it like a link that you could
So
send,
it's
or
a PDF.
a PDF? Okay.
Unfortunately, yeah, that's what I was saying is I need to tell them.
Yeah.
Put it up as a link so I can just link to it on their website, right?
Totally. Well, we can make that. I think we can upload it to the Whova session as like a handout, but also there will be other handouts and things like that available after the conference on the Alliance to End Hunger website.
Perfect.
So there'll be a whole bunch of content there that folks can access.
So I'll get that to you and trust that you'll make that magic happen.
Yes. And then if folks have questions too, one way that we've done this is just by letting people turn on their video and or audio and just popping in to have a conversation. Sure. If that's
I'd love to see some of you guys helpful. Just because when you give presentations virtually, you're kind of talking into a void, right? It's really nice to know who's on the other side of the screen. I would also ask just a question to the kind of audience, if you have other places that you have found data that's been really helpful, either for grant writing or program development or evaluation. I am always excited to learn more. So if you have ones that you've used already, I'd love to hear those too. The other thing, let me open the chat box real quick. So Nat Mudd, I noticed you were from Waco. Are you with Texas Hunger Initiative by chance?
I am, yes. I'm one of the AmeriCorps Vistas serving with them this year.
Awesome. So do you want to talk a little bit, or do you mind talking? I'll put you on the spot, a little bit about how Baylor is using, and the Texas Hunger Initiative is using data, I think specifically around, I mean, Jeremy Everett's a master of doing so many of those things well, but specifically around helping to get, during the pandemic response, to get food to our rural senior citizens.
I can. There might be other people on this call. I saw that Megan Hogue is on here, so she might be better equipped to answer this question. But was it specifically aimed at senior citizens or older adults, or just to people in general?
Well, I knew that one of the programs that you guys had been working on really intently was getting food boxes, senior food boxes delivered, right? So helping to identify where we had pockets of senior citizens who were not able to access food anymore because of the pandemic and their high risk.
Right. The program I think you might be thinking of is Meals to You, which was for school-age children, so from 5 to 18, and it was predominantly serving children in rural areas, so areas that are more spread out that might not have a central location for a feeding / meal site. And we kind of tailored that. It was originally a summer program, transitioned to a COVID program as well. So it started in March and went all the way through August this year. And I think this was the second or third year that this program has been going on. And they plan to do it again this summer. And yeah, if anyone else that is a part of BCHIP wants to elaborate any more on that.
I will also say that one of the things that has been a challenge, I think, for many, many food security councils and coalitions across the country right now, obviously we've seen increased need during the time of COVID, but we've also had a challenge with decreasing. So many of our organizations that are volunteer driven or rely on volunteer hours to actually do the work of feeding people, many of those volunteers are people who are particularly high risk for COVID, right? Senior citizens. I think about the food pantry at the organization I work for has almost exclusively the volunteer portion is almost exclusively retired people, right? Because they're available during the day and have time, and many of them just weren't able at different points in time when we've had high. So we had a spout of community spread kind of early on, and then now we're facing that issue again. And so one of the things that we have done just recently that I didn't include in this presentation, but we surveyed our organization members, basically just asking them, our member organizations, the different food pantries, who was in need of volunteers, so that we could create kind of a database of where there were volunteer needs, and then sent that out to our larger coalition that has a lot of people who might have some volunteer time available, especially sometimes kids who are virtual learning now may have some flexibility. A lot of college students may have some flexibility now because they're doing virtual learning, or they are, they're choosing to be at home in their community in Tyler instead of going off to college this semester, right? And so locally, in order to kind of increase our volunteer capacity, and it just, like I said, that was just a really simple Google Doc survey that we did in order to try to kind of connect people to increase capacity within our community at a time where we had really high demand for our food pantries, but also their ability to physically get food to people was really decreased because of volunteer limitations.
Well, Valerie, I think we can go ahead and wrap it up now, but I want to encourage everybody to continue the questions and conversation in Whova. So you can click on this session in Whova and add any questions that you have for Valerie there. If you have anything afterwards, after you kind of sit on it a little bit today. And so a huge thank you to Valerie for sharing her expertise with us today. And coming up next is a panel that showcases how some hunger-free communities have responded during COVID. So we're looking forward to seeing you there. Have a good rest of your day, everybody. Thanks for being here.
Thanks.
And thank you, Valerie. Appreciate it. Were you thinking of sending me the PDF over email? Because I can send you an email.
That's probably the easiest thing for me to do. What's your email?
It is Anna at swamstrategies.com. SWAIM. And I can make sure that is uploaded to a place that people can access it.
Sounds perfect. Thanks so much.
Yeah, you're welcome.
Appreciate
Thank you
it.
so much. Have a good rest of your day.
Thanks. Bye-bye.
Bye.